licensed therapist. I think, yeah, I'm still licensed. So I also love art therapy and just helping people feel safe and feel connected and feel community. And unfortunately, I had lost that about 2 years ago when I was fired from my position for a video that went viral on social media, essentially me scolding men to go to therapy. Now, my approach is a little like loose and free and sort of like how I talk to my friends. And it may not have been the most professional thing, and as a result, I lost my job, but it opened up a whole host of different opportunities like this one for me to connect and still heal the community. Attachment trauma, that could be having like a disrupted bond from your parents, or like I said, the loss of a loved one. There's sexual abuse that can come from childhood, adulthood, just any type of abuse that way. Natural disasters such as hurricanes, tornadoes, wildfires, those types of things can be potentially traumatic experiences. Physical abuse, accidents, bullying. I received so much hate that from the video that I posted, that I was constantly chronically bullied online, so much so that they called my job and I got fired. So like the bullying and all of it, I still hold a bit of trauma in that regard. Let's see. There's environmental trauma. So not many people like to look at poverty as a traumatic experience. But it is. Like struggling to fight to live is, excuse my language, some of the hardest shit you have to do. So being in poverty, being in an impoverished space, it is environmental trauma. And you can find resources to kind of help you cope with some of those things. Let's see, there's terrorism, there's neglect, socioeconomic status, societal trauma, like police brutality. Black folks, we have a different relationship with the police. And I know when I'm driving down the street, my heart is racing, even if I'm not doing nothing. So that is a level of trauma. So when you're experiencing these traumatic events, you want to pay attention to how they feel in your body. That is key in identifying your triggers. It's like so random and really obscure, but because I do social media, notifications overwhelm me. So I cannot have them on my phone. If I have more than 10, I'm just like so overwhelmed I can't function. So I noticed that I start getting like heart palpitations, my chest gets tight, you might get like the back of your neck might start heating up, you might start having a panic attack, but just pay attention to how you feel when you are exposed to a triggering event. So maladaptive coping skills can include running away, being passive aggressive, avoiding intimacy, binge eating, eating disorders, ruminating on thoughts, so thinking about things over and over and over, and let's see, risky sexual behavior, that is a big one. That is a path of self-destruction when you have to like fill a void. I tend to lean towards that one sometimes. Anyway, dissociation, so that is when your body is physically there, but your mind is not. So I'm glad that you said when you first got here that you're just here, because it's better to be here than there, you feel me? So dissociation is, I tend to dissociate when people are yelling at me. I do not respond well to yelling, so I sort of kind of go to a different space. Let's see, overworking. A lot of us like to work ourselves to death to cope with any situation that we are going through. Working is not bad, but we have to create a work-life balance to, foster a life of peace. Let's see, drug use, withdrawal, anger, damaging property, self-harm, procrastination is the biggest one. Procrastination is sort of, it's putting off, who else? You. I know I'm not the only one. It is putting things off for momentary relief, but the more you put it off, you're still going to experience that incredibly anxious situation. You're going to have to confront it anyway. So these are sort of negative ways to cope. So does anybody know the 4 trauma responses? Can anybody give me one? What you think it might be? trauma responses.
Fight.
Yes.
Oh yeah,
We got fight,
Flight.
freeze.
And then fawn.
Fawn, yes, yeah, period, yes. So we got fight, flight, fawn, or freeze. When you are experiencing trauma, you are experiencing stress. And stress releases cortisol. And cortisol kills everybody. So it's not a good situation. So you want to identify what triggers you, identify how it feels in your body so you can reduce those cortisol levels, because we don't need that stress hormone dysregulating our peace or none of that. Everybody has experienced a traumatic event. It does not matter what it is. I strongly encourage you find a therapist who will support you, because there are some therapists who do just show up because it's just a paycheck. But there are some therapists who are really kind, caring, yes, and compassionate, and will sit there with you in the discomfort. Because these traumatic experiences are really, really, really uncomfortable. And that's why a lot of us tend to not want to confront them. That's why we try to run away from them. And they continue. So here we get to the generational piece. So the trauma that you carry, nobody sees. But it can be passed down through generations. Depression is genetic. Anxiety has a genetic component to it as well. So if I'm going through life carrying all these things that nobody can see, and it's just wearing me down more and more and more, and my environment at home isn't changed, I'm still gonna be worn down more and more, and it's gonna affect my family members, it's gonna affect my community members, it's gonna affect how I function in life. So the most important thing that I look for in therapy is level of impairment. How much is this impairing your functioning from you being your best self, right? My personal favorite self-care activity is taking a bath. I take a lot of spiritual cleansing baths because it's a lot of weird energy outside and you just gotta cleanse it off, you know? Let's see, being empathic with yourself. So giving yourself grace when you have experienced these traumatic events. These things happen to you. They are not who you are. You have to remember that. Especially if you're dealing with like sexual trauma, it's something that happened to you, but it is not who you are. You are not a victim. Let's see. Understanding how your trauma affects you is really important, and being in community like we are here now.